Okay, I'm gonna go ahead and get started. I recognize most of the names of attendees, but a few not. So I will introduce myself. I'm Allie Williams. I'm the head of school at the Pilot School, and we are so happy once again to be welcoming Dr. Winkelspecht back to our community to present. This is the third session in our parent series this year. Tonight, we tackle a really important and as we were discussing before the session went live, a very relevant topic of just understanding depression in children and teenagers. We have been really blessed as a faculty to have Kami with us all year long, working with our faculty on topics surrounding ADHD and being really amazing teachers for our children with ADHD. And we just feel lucky to learn from her on a regular ongoing basis. And these parent series are often as well attended by faculty as they are by parents for that reason. So another good session awaits us tonight. I will hand it over to you, Kami. I will turn my camera off, but I'll be kind of hanging out in the wings. If any of you have questions or comments as we move through the presentation, there is both a Q&A and a chat function. I'll keep my eye on that, as I know Kami will as well. And there is usually time at the end as well. So I hope that you enjoy tonight. Thank you again, Kami, and I'm going to hand it over to you.
My pleasure. Thank you. So I appreciate your kind words, and then I appreciate everybody joining us for the third installment of our parent webinar series this year. So a timely topic as well. So as we're entering kind of these winter months, we also know that, you know, mood is a little bit harder, right? As we have kind of more limited activities and those types of things. And I think certainly in COVID times, that feels a little bit more salient as well. And so hopefully we'll learn a little bit together about depression and its effective treatment. And then the goal. So anytime that I present about depression, I also want to really keep in mind, as we're talking through some of the information tonight, that we also want to instill hope, right? So the goal of treatment for depression and kind of talking about depression is really the message of hope, and so that there's always hope in these situations. And so hopefully we'll learn some tips tonight to help instill hope with those around us as well. So I'm going to share my screen and we'll get started. And those of you who may have attended before, or if you're new with us, you know that I do like interaction. So if you have questions that are relevant, we would rather you put them in the Q&A and the chat box. There are kind of natural times that I'm going to stop and kind of look for those questions, but please don't hesitate to do that. I think everybody kind of joins for a reason. And so it's really great to have you, you know, when the question pops up, to just put it in there and we can address it for everybody at that point. So just as we're getting started, our goal this evening is intended to be educational and not a substitute for a therapy intervention. So if you feel your child or teen would benefit from a therapy intervention from some of the information that we're talking about tonight, please reach out to the counseling team at Pilot for a list of resources. Pediatricians are also great, amazing resources for evidence-based treatment for mental health as well. And I put some good resources at the bottom. So one of these is just an awesome resource about all things related to effective child therapy. So effectivechildtherapy.org. So it's a service of the American Psychological Association, their Division 53, which is focused on child and adolescent care. And so it's a great kind of one-stop shop, so to speak, to kind of look at assessment tools to see, like, is my child maybe struggling with some of these things? There's an assessment part of that. And then there's also information about what effective treatment looks like and kind of how to access that. The other two resources are specifically related to anxiety and depression. So one of them is the CDC kind of information and guidelines that will allow you to kind of, through this link, access statistics about childhood mental health, and then also to learn a little bit about kind of what it looks like in children at different ages. And then the other resource is the American Foundation for Suicide Prevention. And they put amazing resources and messages out there for parents, for kids, and for schools and other mental health professionals to access. And so those are all some good resources at the bottom if you want to learn more. Our focus this evening is going to be thinking about depression from the standpoint of cognitive behavioral therapy. And so we know cognitive behavioral therapy is the evidence-based kind of gold standard treatment for depression in children and teens. And so that's the framework and kind of the lens that we'll think about treatment tonight. So learning goals for this evening, we're going to talk a little bit about the impact of the pandemic on depression. So it certainly had a unique impact and, increased depression in a lot of different age groups. And so we'll think about some of that information and kind of why that makes sense. And then some statistics related to that as well. We'll talk about the facts about depression. So really doing a little myth versus fact. And so, right, you guys are welcome to kind of put in the chat if you think that things are a myth or you think that things are a fact, but we'll kind of hopefully dispel some common myths and learn some facts about depression together. We'll understand the symptoms. So what does it look like in children and teenagers? So one of the cardinal symptoms is different between adolescents and children and then adults. And so I think it's really helpful to kind of think about that because it changes sometimes the context of how you're kind of viewing some of these behaviors in children. We're going to learn about effective treatment. So again, that will, from my perspective, be cognitive behavioral therapeutic treatment. So we'll kind of talk a little bit about what that looks like and some examples about how it relates to depression, because I think sometimes it's a little bit harder to kind of think about how to utilize or how to kind of identify some of these thoughts and feelings and behaviors for depression as opposed to kind of anxiety or something like that. And then we're going to learn a little bit together at the end about suicide prevention. And again, the message here tonight is hopefully that we're going to go through some statistics. And I think it is hard. And I will just, note at the beginning that some of this information can be kind of difficult to kind of hear about and think about. So, please take good care of yourself, right? If you need a little bit of a break and kind of to come back, if you feel like some of this information is triggering, make sure that you're also listening to yourself. But again, the overall message is to think about this from a hopeful perspective, because what we know is that one person can make a huge difference and that treatment is really effective. And there are a lot of ways to access effective treatment to be helpful for these symptoms. So thinking about the pandemic impact on mental health. So I think if we look at these kind of 4 circles, if you will, and then kind of their overlap, I think there are a lot of factors that have been kind of unique about the situation that we're in this ongoing pandemic that have really kind of worked together to kind of unfortunately create kind of the context for a lot of worsening of mental health. And I think the 4 factors that really stand out to me, and as I think about this, from my kind of lens, which is really thinking about this for children and adolescents and then parents, right, who are kind of parenting those kids and adolescents, is that I think these 4 boxes are really where most of, I think, the stress from the pandemic kind of creates this impact. I think uncertainty is a huge one. And as we sit here now, right, in another unfortunate kind of spike in the pandemic, I think we're kind of thinking about things that felt a little bit more certain in the fall that are kind of feeling uncertain again. And it's always challenging when we're in a situation where we're facing a lot of uncertainty, where there are not a clear kind of rules or clear limits or kind of clear decisions, or that information might be changing. The second one kind of relates to lack of predictability. And so oftentimes in the pandemic, we're kind of faced with new regulations, new changes, transitions in terms of what's comfortable for us, what's not comfortable for us. And we know that kids and teenagers maybe don't like to admit it as much as probably younger children, but kids and teenagers are really creatures of habit, that they like predictable structure and consistency and routines and rules. And the more, right, that they can have those types of things, that helps them to kind of deal with uncertain situations so that they know how to apply this rule like in a new situation. It also helps them to be comfortable and confident, right, navigating in their environment. So if they know what that routine is day to day, they're comfortable and confident to kind of take risks and feel a little bit kind of more confident in themselves and their abilities as well. I think fear is certainly one of the factors that has made it challenging. So anything that kind of shakes our sense of safety and security, and I think the pandemic has certainly done that, creates a lot of stress. So that there have been a lot of fearful, this fear of illness, right, overall kind of overarching, then the fear of other things, right? So kind of thinking about that in terms of resources and school and, impact on relationships and all of the other things that kind of come along with that. I think this last circle that we'll think about, and particularly I think this relates and kind of impacts to depression, which is our topic tonight, is thinking about loneliness. So that, the whole term, even thinking about the term, right? We didn't know this term, social distancing, right? Or physical distancing. I greatly prefer physical distancing over social distancing because I think that it contributes to loneliness. in a really big way. So thinking about the early stages of quarantine are now going back to some of those, right, kind of separations, that we're not necessarily having as many social activities. We're not necessarily kind of thinking about connectedness in quite the same way. It's not as easy, right, as it used to be. Even if we're thinking about parents, right, working from home and working from home becoming a norm, there's some great things about that. And there's some challenging things about that too, as we really think about loneliness and kind of its overall impact on our mental health. So we know that being isolated isn't necessarily helpful and supportive. It doesn't give us the best context for success in terms of mental health. And again, you can see like kind of in this diagram, right, this Venn diagram, the overlap. So again, depending, right, on how these situations might be impacting you or your unique situation, then you've got overlap categories, right, that make that additionally challenging. So just kind of a little snapshot of where we are kind of at this point. So thinking about, I think, the early stages of the pandemic, it was a little bit easier to kind of think about after those first couple of weeks of kind of the shutdown in like March 2020, if we compare those to kind of now and fast forward a little bit. So there were almost kind of, 2 years into the pandemic, which as I was thinking about this presentation today, it's hard, right, to kind of think about, right, kind of being in this situation for a couple of years now and how long that it's been creating that impact. So it certainly makes sense in a number of ways that we would be seeing kind of the ongoing, right, struggle, or now the kind of more significant kind of mental health impact as it continues, right, the situation hasn't resolved. So we're continuing to face a lot of those variables that we talked about before. So in March 2020, we had the immediate shutdown of schools, kind of virtual learning, social activities and sport, this real kind of like line and kind of cutoff, which was certainly challenging. These changes to daily routines and, work from home and managing all the different baskets that you had to manage as parents were certainly very challenging, as well as these masking, distancing, rules for activities, right? We started to think about things that really we had never thought about before, that kids maybe didn't even recognize was possible. We had this isolation, kind of missed social activities, and really kind of truncated in a lot of ways what we felt comfortable doing, right? And that, again, at certain times in the pandemic, we were really kind of, punishing in a lot of ways, interacting with anybody who was outside of your, regular house, your household, which made it certainly very challenging. You've got missed life events, that loss of safety and security. So all of those things kind of added up to have a mental health impact. Again, I think we started to see that a little bit more, probably like about 2 months into the pandemic and kind of after the shutdown for kids and adolescents. There was some novelty to some of these things that were kind of enjoyable for, parents to a certain extent, but kids as well. But the longer that became kind of a new normal and it settled in, we started to kind of see that impact. I think we had some resolution of some of those stressors. As again, pilot last year was in, and a number of schools were kind of in for certain grades most of the year. But a lot of schools were still struggling kind of a hybrid environment and a remote learning and in-person environment in a lot of different ways. And so if we fast forward to kind of where we are now, right, we're seeing these COVID rates spike again. So we kind of have almost like a return of some of those things that we saw early in the pandemic. So kind of increased testing and kind of availability of testing, some of this fear coming back, the potential of going back to virtual learning. I think some of the things that I'm seeing in terms of kind of school modifications too are a little bit more of that enforcing of a wider distance. So we're putting kind of that physical distancing and we're thinking about that. So we're changing potentially lunch, routines and schedules. We're changing kind of recess activities. We're changing kind of access to specials or the amount that kids might be kind of mixing in groups to a certain extent. And this is even just in the last couple of weeks, right, that you're starting to kind of see some of those things more again. We've got ongoing modifications and activities and routines at home. So a lot of parents are working from home a lot of the time now, right? And like thinking about that as kind of the new normal, which creates its own, set of isolation. But we've got ongoing kind of modifications and activities, meaning that we have potentially kind of sports activities that are shut down, right, for a certain period of time because of COVID spikes. We've got masking that's going to be required. I hear there's going to be an indoor mask mandate coming from the governor. Maybe that's already actually occurred today. But I was hearing some information about that coming out as well. So we're kind of returning to some of those things that we had in March of 2020. I also want to highlight this one for kids kind of in particular. So this kind of missed life events, I think we think about that sometimes in terms of like larger celebrations. So thinking about that more in terms of kind of weddings or larger kind of gatherings where holidays, those types of things. I think a lot of times for kids, so it's about these little things. And so I'm highlighting birthdays and field trips and kind of small celebrations about, when they kind of learned how to do something for the first time, and people kind of get together and celebrate that. But for a lot of kids, birthdays has become kind of almost like a new kind of found importance, right? So it's kind of your day to have all these special things happen, and usually kids kind of get to be in charge of that. And I think having birthdays in the pandemic has become harder because you can't necessarily choose some of those things. And so I've had more conversations about kind of birthdays and what kids are kind of thinking about, and how they might be missing, right, some of those prior celebrations. And again, these field trips that you hear about maybe for years that you're really looking forward to once you kind of get into that grade. So I think it becomes some of those smaller kind of missed events for kids that I wanted to highlight a little bit. So there are certainly some parallels between March 2020 and kind of January 2022 where we are now. And so I just want to kind of think about that as a backdrop as we think about how do we kind of help to instill hope and kind of create some of this, connectedness in the face of some of the challenges that we're seeing now. Because what we know is that some of those things really help, right? So if we can combat loneliness with connectedness, we're going to see, right, some improvements in terms of mental health. So let's do some facts about depression. First, any questions or kind of comments about that piece? I know that can be a little bit challenging to kind of think about it here. Okay. So we're going to do a little bit of myth versus fact. And you can kind of think about this. If you want to put this in the chat box, you're certainly welcome to, and you can kind of guess whether these are myths versus facts. But there are a few that we're going to sort through together. So myth or fact, one primary symptom of depression in children and teens is irritability. Is this a myth or a fact? What do people think? Let's see, any brave responders? Oh, we have one, thank you. I appreciate that. Fact, myth. Okay, good, thank you guys for engaging. I really, really appreciate it. This is awesome, all right. So it's a fact. So irritability is the primary symptom difference between adults and children and teens. And so we're going to talk about that a little bit with one of the examples about kind of how cognitive behavioral therapy works. I think the reason for this symptom difference makes a lot of sense to me because kids don't necessarily get to be in charge of a lot of the things that they're doing or not doing. And so if you're kind of forcing somebody, right, so to speak, to kind of do things that they really don't feel like they have energy or want to do anymore, it creates lots of tension and conflict. And so this is something that we know to be kind of one of the hallmarks of more teenage kind of childhood depression. Awesome. All right, let's look at this next one. If someone wants to kill him or herself, nothing can be done. Myth or fact? Thank you for putting some comments in the chat box. So myth, it looks like everybody is in agreement on that one, which is great. So yes, right, we know that this is a myth, 100%. So we know that one person asking to help and kind of paying attention to the warning signs and kind of asking how somebody's doing or if they're having these thoughts will 100% make a difference. And again, thank you guys for participating. I appreciate it. All right, let's look at the next one. So children and teens will reach out to peers or a trusted adult and share signs of depression or thoughts of suicide if they show that they're willing to listen. So if the peers, adults, or kind of caregivers or that kids will kind of reach out and talk about. Any thoughts about that? Myth versus fact. Fact. I'm seeing. Fact. Awesome. Yeah, so we know that it's not an easy thing to talk about depression or suicidal thoughts, not necessarily easy for kids. And again, not necessarily easy to kind of be on the receiving end of that for a parent kind of or a teacher. But it's hard, right, when kids have really challenging thoughts and feelings like this. But we know that if we are open to this and we're able to like help them to understand that we're interested and we want to know how they're doing and welcome and invite this conversation about mental health, that they're certainly willing to engage with us. The next one, you must have a reason to be depressed. So there has to be kind of a reason that we can identify. Myth or fact? Saying myth, myth. Any other thoughts on that one? Myth? Awesome. You guys are experts. You're getting to be experts already. So it is a myth, right? So depression can happen to anyone and really be the result of biological factors, stress, or other environmental factors. So sometimes I think what can be a little bit more puzzling about it for parents, as you know, they're kind of trying to identify this in kids and teenagers, is that there's not necessarily sometimes this identifiable thing that kind of happens where it's like, oh, it kind of makes sense that they'd be upset or kind of bummed about this. Sometimes it can really happen, right, as a result of some of these other factors or how they're kind of interpreting and thinking about information in their environment, despite having a lot of successes. Depression is kind of internal. It's one of the internalizing disorders, so it's kind of in the eye of the beholder, so to speak, but it's difficult sometimes to know how kids are kind of processing and interpreting some of that information and their lens for kind of how they're viewing it, which is really important. And then a part of effective depression treatment is getting a little insight kind of into that lens about how they're interpreting some of that information about themselves and about the world. Asking someone about whether they're having thoughts of killing themselves gives them the idea. So is this a myth or a fact that asking somebody about thoughts of killing themselves or suicide will put that idea in their head? Myth, myth, myth. Awesome, you guys are a really great and engaged group, and I appreciate you putting your myth and fact in the chat box there. So this is 100% a myth. This is probably the biggest myth, unequivocally, in suicide prevention. So there's no research that supports that if we ask questions directly about suicide, or we ask questions about whether, you know, kids and teenagers are having thoughts of killing themselves, that it will put the idea in their head. If anything, what we know is that the reverse, that asking that question can definitely save a life and be an access point to helping to feel that kind of hope that we want kids to feel when they're struggling. Awesome, you guys did a really great job. Thank you so much. So facts on depression. So I took these statistics from a couple of different sources. But thinking about kind of our general kind of world, and this is pre-COVID, so these numbers at the beginning are pre-COVID. So at any given time, about 3.2% of children ages 3 to 17 have diagnosed depression. So that means that they have seen either a mental health professional, their primary care pediatrician, and had a formal kind of diagnosis of depression of some type. 2 out of 3 children with depression do not receive any treatment. So by and large, depression goes untreated for a lot of the kids who experience it. We know that suicide is the second leading cause of death in children aged 10 to 19, which I think is a really startling statistic. And these last two kind of highlight this point, and these are more related to the statistics that we've been seeing in the pandemic. So the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry have put out kind of like a call to action and a mental health kind of emergency. And they did this in the late fall when some of these statistics really started to come out. So in the first 6 months of 2021, Children's Hospitals, so the Children's Hospital Associations, across the nation all kind of gather statistics and kind of look at trends. And what they found was that hospitals overall reported 45% increase in the number of self-injury and suicide-related cases in 5 to 17-year-olds in comparison to that same time period in 2019. So that pre to kind of post-pandemic comparison. More than 50% that there was an increase in suspected kind of suicide attempt ER visits among adolescent girls. So in this adolescent girl area, we know that it's increased a little bit for males. It's increased a great deal for adolescent females in the same time period. So particularly for ages 12 to 17 and early 21 compared with early 2019. And so we're seeing a large increase in some of these safety concerns and behaviors, again, as an outcome of some of the challenges of the pandemic. Oh, so I'm seeing some questions. So good one. What's the #1 cause of death, or why do we see it so gender skewed? Great questions. So I think for a couple of reasons. So I would have to check for sure to verify the #1 cause of death, but I think it's like injuries, accidents, those types of things is kind of the #1 cause of death, but I can Google that really quickly. And then why do we see it so gender skewed? A good question, right? And we could kind of debate a little bit about how much, kind of teenage girls might kind of access care and kind of talk about this and right how that relates to kind of patterns that we see in boys. But I think it's a really good question that I think researchers are trying to figure out, right? So do we know a little bit more about this, and why has this impact, right? At least in this time period, why are we seeing this impact teenage girls more than teenage boys kind of in this time period? And so I think that's certainly a great question. And at the end here, I will make sure to kind of Google the number one cause of death and verify that for you for sure. But these facts are really, I think, again, kind of sobering for us to look at and think about, like, again, what are our kids kind of experiencing, and how can we really think about being a part of the solution? Oh, unintentional injury. Thank you. Somebody else did the Googling for me. I love this, right? I love this audience today. You guys are so engaged and amazing, which is awesome. So, right, unintentional injury like accidents, right? That's the number one category. So thank you so much for researching that for us. I appreciate it. I think these statistics, again, while hard to hear, I think also really help us to kind of think about, and for me, right, I think about this kind of call to action that oftentimes when I present about depression in children and teenagers, sometimes actually the least attended seminar in this area. And I think the reason is because it's kind of difficult to talk about, and it's hard to hear some of this information. I think that doesn't necessarily lessen the importance. And so I appreciate all of you guys kind of like taking the time to learn and help us today, because all of us are involved in systems that involve kids, not just our own kids, right, but that we see other kids as well and can be part of the solution. So let's talk a little bit about depression symptoms. So first we'll think about like all the mood disorders that we might be talking about. So I think depression is kind of this larger category that we think about when we're kind of talking about mood and how it impacts kids. It's the thing that we know about kind of the most, but it can be kind of expressed in a lot of different ways. And so I'll just kind of quickly highlight those things. So when people talk about depression, most classically what they're talking about, or typically you're kind of referring to a major depressive disorder. So in a major depressive disorder, you're seeing a significant kind of increase in these behaviors in a certain period of time that kind of lingers and has certain characteristics throughout that. So that mood might be typical, and then you see a really large dip that's really noticeable and fits very specific criteria to be indicative of something called major depressive disorder. And a lot of these things have specifiers. So major depressive disorder has a mild, moderate, and severe category to help us kind of understand, based on the intensity, the impairment, and some of the impact of these symptoms, how significantly that somebody might be struggling. Persistent depressive disorder, it used to be called dysthymia. So people previously heard of that as dysthymia. The new DSM-5 from several years ago kind of switched this diagnosis to be called persistent depressive disorder. So think about persistent depressive disorder. One of my favorite mood disorder researchers, Dr. Mary Freistedt, who's a researcher at Ohio State University, a Nationwide Children's Hospital, uses a great metaphor, I think, for this persistent depressive disorder that sometimes kind of goes unrecognized. I'm going to talk about this. I don't always talk about persistent depressive disorder as much as I think we'll kind of think about that tonight, because I actually think that some of these characteristics have been really like what kids have kind of seemed to struggle with more in terms of the ongoing pandemic. Again, whether that meets full diagnostic criteria or not, I think some of the features of this have certainly been more indicative of this kind of low grade, almost like a fever. So Dr. Freistedt uses this analogy of, if you had a fever of 99.5, somewhere between 99 and 100, and you had that fever most of the day, every day for a year or more, you wouldn't feel great. You would feel off. You'd feel tired. You'd feel a little lethargic. You would be less interested in doing things. And that's kind of what persistent depressive disorder feels like. So it's not necessarily this marked, like drastic change that you see, but it's a little bit of that low grade mood, right? Kind of stress and challenge, and some of these symptoms that are certainly impacting kids and teens, but not necessarily kind of reaching that level of this drastic kind of difference. And sometimes I would say it kind of flies under the radar screen, so to speak, a little bit. And so I want to highlight that because I do think that and then adjustment disorder with depressed mood, which has some of the same features. Adjustment disorders really mean that the mood kind of happens in a brief time period. We could argue that the pandemic is certainly kind of an ongoing like stressor, right? So thinking about kind of we're adjusting still, right, to the ongoing state of the pandemic, we could make an argument. So typically adjustment disorders kind of resolve within about 6 months of the stressor, but I think we could make an argument that certainly the pandemic is kind of a chronic stressor. We're seeing some of this depressed mood that oftentimes looks a little bit more like persistent depressive disorder. You can have an unspecified depression. So sometimes unspecified depression or kind of a depression not otherwise specified, sometimes kind of gets a poor kind of billing. I think sometimes kids don't necessarily meet all of the full criteria of these things that we're talking about. And so when you notice that some of the symptoms that we'll talk about in a minute are kind of present, but you don't really feel like you're kind of meeting all of those things, it might be kind of in this unspecified category, right? If we can't identify, let's say, like a stressor that you're adjusting to, then it might just be a little bit off, right? And they're really experiencing a lot of those kind of mood challenges of depression, but not fully to meet kind of one of these other diagnostic levels. Bipolar disorder is another significant mood disorder in children and teens. We won't think about bipolar disorder tonight. So again, we're kind of focusing on the low mood piece of this. But bipolar disorder is kind of indicative of a cycling between kind of elevated and kind of euphoric, really expansive, kind of happy, way happy, right, kind of mood, and then contrasting with one of those major depressive episodes. So they kind of wax and wane together. Bipolar disorder in children and adolescents is uncommon. So it's not something that would be a typical, right, kind of like first diagnosis that families are kind of thinking about. So what does depression really look like in children and teens? So what are we kind of seeing, and what do we kind of notice as parents, and then what are we seeing a little bit more clinically? So that you might have a limited range of emotions. So everything is just kind of like blah. One of like my favorite new words and kind of emojis, I think, is this meh kind of idea. And I feel like a lot of people in the pandemic have felt kind of like meh, like it's like, right? It's not good, it's not bad. It's kind of like this, like in the middle, kind of like yucky feeling. And so you won't necessarily always see like a bigger range of emotions. So you won't see more of those times that kids are kind of excited or that they're really sad and tearful, but you're kind of seeing a very limited range of emotion. You'll see hopelessness. And so hopelessness really looks like not necessarily kind of looking forward to or being hopeful about the future. So there are not a lot of things that you're kind of thinking about, oh, I really would look forward to this. This is something that I like about, my day. I know that this situation is going to change in the future because these are the factors that I'm kind of thinking about that are going to help to make that change. So hopelessness is certainly very characteristic of depression. You'll see a lot of tearfulness. So I don't know that I always see kids kind of cry as much, right? Sometimes kids cry, right, with depression, but sometimes not. I think you're almost seeing kind of this verge, like I'm on the verge of crying a good bit. And in situations that you wouldn't necessarily expect would have that much of an affect change. So, right, in situations that might be kind of like typical, right? Like, oh, you're a little disappointed, right, that something didn't happen. I'm going to use kind of a birthday example here because I think birthdays have been particularly challenging, right, for kids to kind of deal with changes and kind of like parties and, those types of things. And so having a little tearfulness when you're talking about some of those things and kind of what your backup options, might be, that type of stuff. Irritable mood, as we kind of talked about a little bit in this myth versus fact activity. So irritable mood is a specific difference between children and adults. And so I think it's also one of the things that people notice the most because irritable mood stands out, right? So it looks edgy, it creates a lot of arguments, things just don't feel kind of quite right. Nothing seems like you're enjoying it quite as much as you did before. That you're just feeling really kind of off, right? For lack of a better reason. Quick to anger, quick to kind of have an outburst, those types of things. And this irritable mood we know can be very characteristic of children and teenagers. This kind of replaces that lethargic criteria that you're seeing more, right? So difficulty kind of getting out of bed, kind of getting up and going that you see as more characteristic of adult depression. This irritable mood kind of takes the place of that because again, kids are not necessarily able to make choices about whether they go to school or not, right? So your 10-year-old isn't going to say like, I'm just going to lay in bed and I'm not going to do anything today. And parents are going to interact with the child and say like, we have to get up, we have to kind of do things. And so when you're kind of in a situation, and again, I think that's a good thing, right? So don't get me wrong, I'm certainly not arguing that we kind of let kids do that either. But I think when you're then forced to kind of do things and kind of get up and engage in activities that you might not be enjoying, you're not really happy about that. So you feel kind of edgy and a little bit yucky and you get a lot of arguments. Loss of interest in activities, so that nothing really seems very interesting or enjoyable anymore. So things that I used to like, I'm kind of like meh about now. I don't really care that much anymore. And I'm not really interested in doing new things either. Changes in eating habits or weight. So sometimes you'll see kids kind of have more hunger, less hunger, and you'll see some associated weight changes over time related to that. Difficulty sleeping. So I think challenges with sleeping have been really characteristic of some of the challenges we've seen overall in the pandemic. So that's either sleeping too much or not necessarily sleeping enough, and having a very off kind of like sleeping schedule that it's taking a long time to get to sleep, or that you're tired all the time, right? And you're seeing a lot of, again, tiredness at school too. I think schools also are in a position where they see these changes and kind of difficulties in sleeping as well. Kind of slowed motor movement. So you're either moving a lot faster or a lot slower than you used to be. And then people are kind of starting to notice that and pay attention to that. You feel tired a lot. So you don't really have a lot of energy and you feel pretty fatigued. Kids in general, right, without having a medical condition, those types of things, usually have pretty good energy, right? A lot of parents would say sometimes you want to bottle kind of that, younger child energy and then kind of use that, right, as an adult, save some of that up. But kids who are depressed are kind of having these challenges with low mood, really just don't feel that energy and that enthusiasm and feel pretty fatigued and tired a lot. So younger kids, you'll definitely hear a lot of negative thoughts about themselves. So you'll hear this throughout kind of childhood. I think sometimes adolescents and teenagers are a little bit more aware and kind of monitor some of these negative thoughts. But I think you'll hear with younger kids and kind of kids in that transition kind of age range between 10 and kind of 12 or 13, some of these negative thoughts just kind of come out. And I would call it kind of negative self-talk. Like, I'm never really good at that. Why can't I ever do anything right? Like those types of little things, right? That kind of add up if you're kind of hearing them more and paying attention to that over time. Inappropriate levels of guilt, so feeling really bad about things that didn't go the way that they hoped that they would, or feeling excessively kind of upset about kind of spilling milk, doing other things. It's oh, I'm so sorry that I can't believe I caused all of those big problems, we ruined dinner, right? A really kind of excessive response to something that might be a pretty common error. Diminished ability to concentrate. That's actually the case with a lot of childhood disorders, but this is one of the things that kids come up are certainly evidencing a lot. And so they have less ability to kind of concentrate on things because they're just feeling poorly. And that might be related to sleep. It might be related to eat, or just generally, right, kind of how excited they feel about day-to-day activities. You can certainly have thoughts of death, suicidal ideation or intent. So the thoughts that occur, kind of once, or a pattern of those thoughts that are occurring more over time. Those don't have to occur in the context of just depression, but they certainly are more characteristic of depression. But again, they can occur with other things as well. What we know about kids and teenagers is that can kind of result from anxiety or other types of situations as well. And you'll see changes in their routines and behavior, right? One of the behavior kind of changes and routines that you see change a lot or shift a lot would be kind of interest in hygiene. That's particularly notable, I feel like, in kind of the middle school to kind of high school age range. So when kids start to typically take a little bit more responsibility and kind of notice that and have more parts of that kind of getting ready routine in the morning or getting to bed routine, the kids aren't necessarily putting in the effort and time to those daily hygiene tasks the same way that they were. So now we want to think about what's typical mood and what's kind of something more. So everybody's kind of been sad or cheerful at times, and this might go away without any intervention. So I think most people at some point in the pandemic felt kind of sad and a little bit hopeless, right? If we look at some of these criteria, had sleeping changes, that we're certainly, kind of individuals have these symptoms, right, over time. So we certainly kind of see these, right, kind of come and go, and that not necessarily any formal intervention might be needed. So depression is really a pattern of behavior over time, so that you want to be kind of thinking about and kind of watchful for, things in this list, as a parent, and kind of the time period of these symptoms. So if you're noticing some of the symptoms that we talked about, and then you're kind of thinking about, how long has this been going on for? So is it happening most of the time, most of the days, for more than 2 weeks? Has this been something that I've been seeing? Are the symptoms preventing success at school? So are teachers kind of seeing this? Are we seeing some impact on kind of academics, right? With lack of attention to detail or lack of follow through with assignments, like those types of things. Are symptoms resulting in changes in activities and interactions? So are kids missing out, right? So that they're not necessarily interested in hanging out with friends anymore. And I say that because I think interest in that kind of might be high, where maybe the opportunity, right, in COVID is kind of different, but that kids are kind of still excited about those things. So they're not as interested in those things. They don't really want to play kind of a sport or an activity that they used to like to do. Like, hey, let's play a game. It's like, I don't really want to. So that's even things kind of in the context of your own house. Like, oh, you used to be really excited about, game night, family game night. It's like, no, I'm not really wanting to participate anymore. Are you seeing sleeping and eating changes? So I think those are sometimes one of the things that you can also see a lot as a parent. If you're hearing kind of kids up a little bit more, it's taking a long time to fall asleep. You're seeing them kind of eating a lot more or less. And suicidal ideation or any expression of suicidal thought should always be taken seriously. So I get the question a lot, how do we know if kids are really serious about this? And my unequivocal kind of advice about this is that you always want to take this seriously, because you don't want to run the risk that you're wrong and that it's not necessarily serious. That the risk in this situation is much greater than giving some attention and kind of due diligence to make sure that you talk about this and that you ask kids about this directly. So these always warrant immediate attention, right? I hear parents ask a lot about, like, they say, oh, I'm just so mad, I'm going to kill myself. It's like, okay, but that's not really how we want to express anger, right? So I want to take that seriously. I want to say, hey, talk to me a little bit about how you're thinking and feeling in this situation. Is that something that you're seriously having thoughts about? Tell me a little bit about kind of what's going on and how you're kind of managing those things. So I always want to make sure that I'm giving attention to that and understanding, is this something that the child's really experiencing or not? And again, right, maybe talking with kind of school counselors, parents, you're kind of linking with other individuals to kind of see, are these concerns that you're seeing as well? So parent takeaways. So take notice of patterns of behavior. So if you notice a change and you notice that change continuing for, a couple of, weeks, I wouldn't attribute it and say like, oh, they're probably just upset this week, or it's a really tough time with midterms. If we're seeing these things happen and kind of continue after some of those stressors or times have evolved, I want you to kind of trust that parent instinct. Sometimes I call it kind of your spidey sense, right? That you kind of want to trust your spidey sense as a parent. If things are off and you're a little bit concerned about something, I really want parents to trust that, because parents know their kids best, and they know what are typical patterns and concerns and what are not necessarily very typical patterns and concerns. And so you really want to kind of take that kind of hunch that you have and that spidey sense as a parent seriously and kind of talk a little bit more about it. So talking with your child and teen and being open to hearing how they feel. So when you ask these questions and when you talk to them, you have to be really open and kind of validating and reflecting to make sure that you're really understanding how they feel. So I oftentimes think when I'm kind of talking to parents about communicating with kids about mood and kind of mental health and stress, you really want to talk less and you want to listen more. And we're really avoiding kind of the tendency to problem solve at those times. So I think it can be really distressing when you notice some of these changes in your kids. And so you really want to think about helping to understand kind of their perspective and what are they kind of seeing and what are they thinking. So what's their mood like day to day? So how'd you feel today, right? One of my favorite questions, my kids would definitely say that I asked probably too many of these questions, but I like scaling questions. So if 10's the best mood and 1's the worst mood, tell me how today is, right? So, okay, today's maybe a 6. What are some reasons that it's a 6, right? What makes it a 6 versus other days? How'd you feel yesterday? To give me some relative comparison. So if, again, I'm starting to kind of understand some of these patterns, I always like to have a little bit more data to kind of compare it to and have a good sense about like what's kind of going into their ratings and what are they kind of focusing on day to day. What helps to improve your mood and what makes it worse? So do they notice what helps them to feel a little bit better and what certainly kind of worsens or kind of dampens mood? Most kids know the answers to these questions and have at least general kind of areas, right? Where they'd say, okay, it's good to have like no homework or something like that, or it's kind of weekends are a little bit better. Again, that's not always the case, but just to give you a couple examples, kids are usually pretty good about trying to determine things that they kind of enjoy or things that they don't necessarily enjoy. Has it been happening more recently? So do they also notice that there's a change in this behavior? And have they thought about it? Or have they talked to anybody about it? Would they like to talk to somebody about it? Do they think it'd be helpful to talk to a school counselor, or for us to continue to check in about it as parents? Or would it be helpful to have a therapist to talk about it? So again, just being open to the conversation and being intentional with what you're kind of doing in that conversation. So to validate, to listen, to kind of really understand that perspective, to show them that you care. Ask questions. So if you're ever worried or hear concerns or thoughts about suicide, you want to ask questions about it very directly. There's not a magical question. So I did training for years for psychologists in training. So internship training, practicum student training, fellow training. And I think even providers in training kind of worry about what's the right question to ask. And I think it's less important what's the right question. It's important to ask. And so being really direct and saying, like, have you ever had thoughts about killing yourself, is a really direct way to kind of ask this question and open that line of conversation. And make sure, again, that you're engaging versus avoiding questions like that. Again, it's less about what's the right question, because I think it can be really stressful, right, to think about asking these questions and kind of what that answer might be. But you want to be open to knowing if there's a risk that your child's experiencing. So treatment for depression, I'll just pause there and see if there are any specific questions about the information that we covered so far before we kind of move on to treatment. So we certainly know that there's a lot of effective treatment options that are out there. And so we'll kind of talk a little bit about what that looks like. Any specific questions? Okay. So we know that treatment for depression is effective. So we know that it works. We know that if kids can access it and kind of get engaged in treatment, children and teenagers, that it can be effective also in a pretty short period of time. So in the span of kind of 4 to 6 sessions, right over the course of, that time period, you can start to feel a marked difference. Research from adults in emergency rooms actually tells us that a single intervention about kind of safety planning and risk reduction in terms of suicidal ideation can be enormously helpful at instilling hope. So a single session where we're kind of managing one of those emergent situations can instill hope and create a large amount of kind of change in symptoms. Looks like we got a question. Great. So if a teacher thinks a child might be depressed, are they obligated to inform authorities? So I'll take a guess about kind of what you mean related to that. And I would say, like, are you obligated to inform authorities? Usually that kind of category of information sharing probably relates to risk. And so if children are having thoughts about like harming themselves, they're talking about that, right? That you're making sure that, you're kind of checking in, I think, with some of your resources at school to say, hey, like, is this a concern? Can we help? Can we talk to parents about that too? And again, I think the like informing authorities is kind of like an extreme kind of like solution to that problem. So I think first kind of thinking about talking with your team at school, talking with the child, talking with parents, and kind of doing a lot of support to see what can we do, right, to help this child, right, know that we care about them and support them, but that we can see that they're struggling. And so that you're kind of getting some of those resources in place to try and better understand what's happening. I think whether you are obligated to kind of talk about it with authorities is certainly like a case by case, probably like situation. And again, is that more extreme kind of like safety behavior where I'm really worried about like risk of harm, then it falls into kind of that category of like a mandatory reporting, something like that. Or you're worried about some imminent risk or harm. Other questions or thoughts? So we know treatment's effective. We know it can be effective in a pretty short time. We know that brief, again, single interventions related to safety planning and kind of reduction in access to like means in those safety kind of suicide situations can also be really effective. Mild depression, so again, thinking about this in children and adolescents, is often treatable with therapy alone. So in that mild category, we know that cognitive behavioral therapy is really effective. For moderate to severe depression, oftentimes a combination of medication and therapy is needed to really kind of jumpstart and kind of help to change that kind of trajectory towards, treatment and treatment success. And again, that depends, right, on each individual child and each individual situation. But as you're kind of working with somebody, you're thinking about this kind of in a clinical sense. That's why you have some of these specifiers to kind of help you understand how significant is this and how much impairment is creating and how quickly do we anticipate, right, kind of having a change in those symptoms. And again, therapists are going to be able to talk about that, should be able to talk about that and kind of predict that with you and give you some recommendations related to that. Though I am not a medical doctor, so I don't prescribe medication at all, I wouldn't be doing my job well if I didn't say we know that it's really effective in combination with therapy to be helpful for depression, again, and more specifically with moderate to severe depression. So we know that effective therapy intervention for kids and families is cognitive behavioral therapy, so CBT. So we will talk a little bit about what that is. And then family involvement is crucial. So I always say with families that the likelihood that your child's probably experiencing their most kind of distress or sadness when they're sitting kind of in the office, let's say clinically in a visit with me, is not very likely. And so we really need parents to kind of be engaged and caregivers to be engaged in this process to know how do we kind of help your child feel that support and understanding, and what do you do in the moment to kind of help them manage that. So parents and caregivers should be incorporated in treatment for all children and teens. So really thinking about that again, the amount that you do that or how that you think about that. Again, this is my, kind of belief in treatment for sure, that one of the benefits of being kind of a child and adolescent is that you have a team, right? And that team is, family, and that team is teachers, and that we can all work together to kind of help you meet your goals, right? Of feeling a lot better. So what's cognitive behavioral therapy? So we think about it kind of in this triangle. So we know that our thoughts, feelings, and behaviors are all connected together. What we notice the most are the feelings part of this, and then sometimes the behavior. Sometimes we recognize what it causes us to do. Sometimes we don't necessarily. I think that this feelings part is really notable, so that we get a little stuck in terms of this feeling. We feel sad, we feel lonely, we feel upset, and we're really kind of focused on some of those feelings of depression. What we know happens is that there are kind of automatic negative thoughts that usually happen in these situations that kind of predict how we feel and then what we do, right? And our behavior kind of directly relates to how we feel and what we're kind of thinking about ourselves in that situation. If I'm thinking about treatment across the age range, so younger kids have much less focus on cognitive pieces. So younger, I'm saying kind of 10 and under most of the time. But again, that's based on developmental age and kind of like, readiness for some of these skills. But we see kids start to think about their own thinking and kind of have more complexity to those negative thoughts as you get kind of 10 and up. Certainly as we get to more kind of traditional teenage years, you'll see more of this kind of cognitive, like thought part of cognitive behavioral therapy start to develop or kind of characterize the depression a little bit more. The behavioral part is really big for younger kids. So we want to get them engaged and doing a lot of things that are going to help them to feel better. We're going to make good guesses about that together as a team. So that's parents, that's teachers, and that's kids kind of working together to figure out how we can help them to kind of feel a little bit better. So the goal for cognitive behavioral therapy and depression is to instill hope. So your job is to really think about, or my job kind of as a psychologist when I'm thinking about depression, is what are the ways that I can help kids to see that it can be a little bit better than it is right now, and that you can change that pretty quickly by having some help in a variety of different ways and kind of being intentional about some choices. Again, I'm kind of boiling this down to a few base principles just to kind of give you an idea. So let's think about these two examples. So we'll take a couple of symptoms of depression. So isolation and then lack of interest in activities. So how does this kind of cognitive behavioral therapy model work? So you'll see kids kind of be sad, lethargic, kind of upset. And I'm thinking about this isolation one related to kind of like a recess scenario. So kids kind of on their own, kind of walking around, not necessarily very active at a time that you'd expect them to perhaps be a little bit more active or kind of engaged in the day. They might be kind of thinking to themselves, the other kids don't really like me, so I don't have any friends, nobody really likes me that much. And what's going to happen, what behavior is going to relate to that sad feeling and kind of that negative thinking about themselves, is that they're not going to ask anybody to play because they've kind of already decided that the other kids don't like them. So what we see in depression is you have negative views about yourself, about others, and kind of about the world. That's kind of one of the overarching kind of cognitive parts of depression, that we have these negative impressions and we make these false kind of predictions about what other people are going to do, these distorted views about the world. So it's pretty likely that there's probably some kids that would enjoy hanging out with, right, this child at recess, but they're just not seeing that because the sadness is kind of putting this like dark cloud, so to speak, over kind of all of those interactions. And so then when they're avoiding asking somebody to play or they're playing on their own, what it does, it kind of reinforces that negative thought, right? So if you're not necessarily interacting with anybody, then this loneliness and this isolation cycle kind of continues because you're not really encountering other information to help you see that it's actually a little bit different than that, or you're not highlighting your attention to that. Lack of interest in activities, and we'll think about this more related to kind of that arguing. So like as you're talking about like what are we going to sign up for, what summer camps might you be excited for, this is the kind of season for thinking about summer camps again. You might see some of this sad kind of tearfulness, like nothing really kind of interests me, I'm not really sure, none of those activities are something that I would want to do, and they're feeling kind of sad, right, or a little bit tearful in these conversations. They might be thinking, I never enjoy any new activities. So all of these things sound terrible. I've never had a new activity that I've really enjoyed. So what's the point in trying? So having that really kind of negative thought about kind of the world, right? There's no activities that they might enjoy. And what's the point in kind of engaging in this? So what happens is you might argue a lot about like these activities. So should we sign up and then kind of drop out? Should I argue a lot because I really don't want to participate in them? I really don't think, right, if this is what you believe, that you're never going to enjoy this, then what's the point of trying? That you've never had a new activity that you can remember that you've enjoyed, then you're going to probably argue, right, and be a little bit irritable about all these great suggestions, right, that your parent might bring to the table. And it's like, they just don't get me. I don't want to enjoy any of these things. And so then what happens if you don't necessarily sign up for anything or don't kind of take that chance? That kind of reinforces this idea that there are not new activities that you are going to enjoy, right? Because you're not in any new activities. And so it kind of is an unwitting kind of negative cycle that continues. Any questions about treatment before we talk about suicide prevention for these last few minutes? And that's, again, just a nutshell kind of view of what cognitive behavioral therapy is. So the goal of cognitive behavioral therapy is to help you to understand kind of the connection, thoughts, feelings, and behaviors. How are they all connected together? And then what can I do to start changing it? So an intervention is not cognitive behavioral therapy if you're not doing something to actively shift a behavior. So we're going to figure out how to try a new activity or what group that you might want to join at recess. And we're going to help you, right, to kind of take the step to do that. And then evaluate afterward, how did it go, right? So did you have fun? Were they more receptive than you thought? Did you enjoy kind of playing with them? And then how'd you feel? Did your mood improve a little bit because you had that fun at recess? And how can we take that opportunity to then start building more of those like successes and having, again, a more sustained kind of positive mood improvement? Okay, so we'll think about suicide prevention for a few minutes last. So warning signs for kind of suicide prevention. So these are different things that we want you to kind of think about for children and teens, so that if you're hearing kind of talk or thoughts about this or seeing these behaviors, that these could be signs, right, that a child or a teen might be having that. Again, this does not say there's a direct link between this is the behavior and this is what's going to happen, but these are things that we know are important to be kind of thinking about and kind of paying attention to be watchful for when we're kind of managing depression or when we're kind of working with children and teenagers. So things that teenagers are going to say. They might talk about wanting to die or suicide. They might talk about feeling hopeless or having no reason to live. Talk about being trapped in a situation that they can't get out of, or in a lot of like pain or discomfort. Talking about being burdensome. That's something that we know kind of relates to this hopelessness feeling a lot, so that you're feeling like a burden to other people, that, you know, your existence kind of creates this stress or distress for other people. And then talking about kind of seeking revenge, it's a little bit more of an externalizing kind of depression. Behavior, so what might kids or teenagers be doing? You might be looking up this information online, so kind of access to resources and reviewing what kids are looking at in terms of content can be really important, right? So like text messages, social media, search, histories to see what are kids kind of like Googling, what are they really thinking about? Visiting or calling people to say goodbye, giving away prized possessions. You'll see kind of a change in reckless behavior sometimes. So increasing kind of recklessness, so that might be driving like, erratically, increasing alcohol or drug use, sleep changes that are pretty extreme, withdrawal, isolation, and then kind of extreme mood swings. So things that are really kind of extreme from each other, right, in a pretty short period of time. So protective factors, things that we know decrease risk in terms of kind of suicidal behavior and suicidality. So having an established relationship with a mental health care provider, a healthcare provider like a pediatrician. So some kind of established relationship, therapeutic relationship where you're kind of talking about this and feeling comfortable to get support. Connectedness. So one of the things that combats loneliness is connectedness. So connectedness to individuals, community, family, pets. Pets are huge for kids. And so thinking about that, I also think pets were kind of like, if we're thinking about kind of winners from the pandemic, I think pets are actually the winner in the pandemic game. So, right, I mean, thinking about the amount of adoptions, right, for cats and dogs and other types of animals that have happened during this time period is pretty huge. But the kids are really relying on pets a little bit more, right? And they care about the pets and who's going to be there for them. So connectedness and community, again, that's school, that's could be religious or kind of like church groups, it could be sports teams. Connectedness to all of these factors really help to kind of decrease risk. Problem solving skills. So how well can kids kind of think about alternative solutions, right? Can kind of help them think about different solutions, right? In this most extreme kind of situation. Coping skills, so that they're pretty able to cope with kind of stress and be kind of adaptable. So are they able to kind of like be flexible and kind of think about things kind of being different in a short period of time and kind of cope with something that might be a stressor pretty effectively. Self-esteem, so having a healthy sense of self-esteem can certainly be an insulating factor against risk. And then the last one is kind of cultural, religious, or spiritual beliefs that kind of discourage suicide. So these are factors that we know that might be present in, again, kind of family of origin, kind of religious, right, orientation that really help to kind of insulate against this as a particular risk. So accessing help, I always like to put up the information about the Suicide Prevention Lifeline. So we know that help is available, and the Individuals who answer these phone calls are amazing at helping to help people feel hopeful, right? So again, these numbers actually work for kids and adults. And so just having some of these numbers and knowing that that access is there can absolutely save a life. There's an interesting article too that came out fairly recently that talked about, so there's a song actually that puts the information about the suicide prevention lifeline out there, and the calls to the suicide prevention line in the time period kind of after the song was released went up significantly, so that we know that making this information accessible and in ways that kids and teenagers can use and feel validated about is absolutely helpful. I read a really interesting article about that last week, that this particular singer didn't really know, right, the impact that that song might have, but thought it was important to kind of make a statement and that there was a real data impact from doing that. So this resource is there, free, available, 24/7. So parent takeaways from this evening. So kids will talk about their feelings and thoughts if we give them an opportunity. So I want you to lean into asking the question, having the conversation, lean into those, difficult conversations versus avoiding or finding a different opportunities, so that we know kids will talk if they feel like we're going to be listening and that we're actively kind of trying to give them that opportunity. Pay attention for changes in mood and behavior. So again, as a parent, you notice, right, your child's behavior day in and day out. And so really be a student of that. Are you noticing changes? Are you seeing things that are kind of alarming or concerning? So pay attention to that and kind of trust that, again, that spidey instinct that I said, right? If your instinct tells you that something's kind of not quite right, make sure that you're asking and engaging with them and getting information, right, from other sources like schools to see if they're noticing anything as well. Treatment's effective. We know that it's effective and that parents are a really important part of this process for children and teens. And so you need a good team as a child to kind of be in your corner to help you to deal with a difficult time. And so we know that parents are a really important part of this process, but that treatment is really effective. Also ask directly about suicide. So take that risk seriously. If you hear talk, anything related to those concerns that we talked about tonight, ask about it directly. So one concerned and caring person can absolutely save a life and instill hope in that particular child or adolescent and other people around them as well. Other questions? So we'll just open it up now to kind of think about questions that you guys might have or helping this information, address any of the needs that you kind of joined for this evening. I know it's a heavy topic on a Monday evening for sure, but I appreciate you guys again joining and listening and kind of learning along with us this evening. Any thoughts or questions at all? You guys also did a great job of participating, so I really appreciate that with the myths and facts and researching some things along the way, so I greatly appreciate that as well. Oh, you're welcome. Thank you for the feedback. Absolutely. Yeah, interesting. So you've heard kind of mental illness presents in kind of college years. Does depression equally really present earlier in kind of kids and adults? Like kids and adolescents. Okay. So I think that's a little bit more difficult for us to probably get a sense for. So one of the barriers to understanding kind of data and base rates of mental illness in children is one, like the reporting tools that we have, right? So kids kind of have to be their own reporters about some of this behavior. But we also, like as parents, right, parents have to consent for kids to participate in research. So we could certainly argue and say, like, we could certainly debate and say, are we capturing, right, all of these statistics accurately for all of the groups that we need to? If I even think about this specifically for the pandemic, so a lot of that research is actually conducted in schools, right, in the context of, schools and large scale, right, NIMH funded projects, like those types of things, CDC surveys. that kids and adolescents can participate in. So when we were in remote learning for a certain time period, I don't think we were actually capturing a lot of, what might be kind of going on and changing for kids and teenagers, because again, schools are a place where kids spend a lot of their time and help us to really understand some of these patterns, right, and collect some of this data, again, with parent permission, but they provide a mechanism, right, for these research studies. And so I think, as a college student, you're also an adult. So most people, as they transition to college, are 18, so they can consent to participate in these things on their own at a much higher rate. And so it kind of decreases some of the barriers around, consent for these studies and those types of things. So I think it's hard to know. I would certainly say that we know depression and anxiety have both kind of gone up in the pandemic, and we're seeing a lot of strong evidence for that for kids and adolescents for sure. I think the transition to college is kind of interesting and challenging for a lot of different ways too, right? So that age range between 18 and kind of 22 has a lot of changes, right? Almost similar in some ways to like the entrance into school, right? The first time, right? From a preschooler, that we see all of this, like, kind of homesickness and struggling to figure out what you're going to do in the world, which could certainly be different. But I think it's an interesting question. I'm not sure, right, whether it kind of like we're under kind of representing, let's say, kids and adolescents, or we're kind of thinking about this, over-representing that in adults. But I certainly think that we're starting to pay attention more to like kids and adolescents and their mental health needs, and that kids are also starting to really be a part of driving the conversation, which is awesome. So I can't tell you how much more that I've heard in the past kind of 3 to 5 years, kids reaching out and saying like, I really think I need to talk to somebody about this, or I'm not feeling quite right. I think, I would appreciate having some help on this. And I think the more that we talk about it, the more that we're going to know, right, how much this is really a challenge, and what we can also do to help. So I appreciate that question. Other thoughts or questions? Sure, absolutely. I also think yeah, go ahead.
Nope, you go ahead, jump in. With
oh, that's okay. I was just going to say the other thing that sometimes we hear a little bit more as you're thinking about this kind of adolescent to like adult transition is that some of the statistics we collect for things like more serious mental illness, so schizophrenia, bipolar disorder, those types of things would typically kind of have an onset in kind of adolescence, kind of into that like before kind of age 30 age range. And so that might be right where you're kind of hearing some of that statistical information too. So there are some things that we know that are again more kind of significant, have a larger genetic component that we know will probably be expressed in a certain time period, or it's more likely, the likelihood of that increases. Other thoughts or questions?
I will just jump in and include a comment with my thank you to
Sure.
you, and just say that I was really happy to see, parents and faculty here tonight. The topic, as you mentioned a couple of times tonight, is one that is not the most comfortable one to think about and talk about, but it also is something that we know we can intervene and make a difference.
A huge part of the change.
Yeah, absolutely. So, and it feels very relevant, to anyone working with kids or who have kids of their own. So thank you. I really appreciate, as always, lots of notes. Always
absolutely,
really
my pleasure.
Time, a good way to spend an hour on a Monday night. I really appreciate it.
Absolutely.
Thank you to everyone who came tonight as well. This was really great and a good participatory group tonight. Much appreciated.
Yeah, thank you guys so much. I appreciate you guys jumping in and asking great questions and doing some of the research, right, to help us out too. So I appreciate that. And thank you again to Pilot for hosting this important topic. So I think you guys continue to kind of advance the conversation around this, and I appreciate being a part of it.
Have a good night, everyone. We'll log you off now.
Bye, take care.